Hut was Mahatma Gandhi's hut, Sevagaram Ashram. A young man was standing outside this hut and he was waiting to meet Mahatma Gandhi. Mahatma Gandhi's appointment times used to be 2 minutes or 3 minutes. This young man entered the hut. He was recently released from the prison. He had joined Quit India movement. Gandhiji was sitting on the floor of the hut. He looked at the young man and asked him, "Bataiye professor, kaise aana kiya?" Young man said, "I have just been released from the prison and now I want to do PhD in economics. I have received scholarship and PhD admission in University of Ohio and I want your blessings." Gandhiji looked at him for a few seconds and then uttered a single sentence. अर्थशास्त्र सीखना है तो अमेरिका की जगह भारत के देहातों में जाओ. And that's it. Then he started looking down and continued writing what he was doing. Young man came out of that hut. Standing in that square, he tore away his visa, passport, scholarship paper and straight away went to a nearby village. A lifelong Gandhian, we used to ask him that what made you change your life's trajectory based on one sentence of that old man. He told us, when Gandhiji asked me to go to the villages of India, he was sitting in a hut constructed by mud in the sweltering heat of Wardha near Nagpur, central India, and then he was advising me. So essentially the advice was, go where the problems are and not where you are the problem. All of you as well, as far as possible, you learn and go out there where the problems are. With that one message, my parents, both doctors, subsequently trained in Hopkins, came to India back and went to this place, Gadchiroli. Where is Gadchiroli? Central part of India, deeply forested. This is the ancient Dandakaranya forest of India where Ram spent his Vanvas and Pandava as well, Shabari as well. The main source of income is minor forest produce of Tendupatta and Mahua, etc. Paddy cultivation is the main source of livelihood. Villages are scattered far across. Distances are large. This was the main source and transport, bullock cart. Now you can imagine a district 400 kilometers where a woman with obstructed labor and she has to go on a bullock cart to seek caesarean section. Such was the monsoon where we are living and such was the infrastructure. So you can imagine the situation. And on the top of that, the icing on the cake was the Naxalite left-wing insurgency affecting the entire central India for last 40 years. This was Gadchiroli. Outside every village, we would find this kind of god and goddesses and traditional healers because modern medicine was absent. So people were seeking care from gods and goddesses. There was no other alternative. We started our work. The second principle that we decided to follow in our work was this. One accurate measurement is infinitely superior to 1,000 intelligent opinions. We Indians have opinions on everything. How should one resolve Trump crisis? And how should also control rats in the municipal corporation? Generally wrong, because we are opinionated. We decided that whatever we will do will be based on measurement. And hence, we set up what we call a community laboratory of 86 villages. A laboratory which is not inside the walls, but in the public. That's where public health is. Asking two questions. How many children die and why do children die? This was the answer. We found that the infant mortality rate, children who died before attaining 1 year of their life was 121 per 1,000 live birth. More than 1 in 10 child before achieving the age of 1 year would die. These children had no vote, or no note. They would only cry and they would die. The most vulnerable section of our society, and the glory of our society was defined by how we treat them. So we decided that this should be our priority. What should be the principle that we follow if we want to learn something from China? This is a beautiful principle. The first People's Health Congress of China decided that how should healthcare be, how far a mother on foot can walk with a sick baby, healthcare must be made available within that distance. Doctors should go where children are and not the other way around. So we decided that we will develop a program called Home-Based Mother Newborn Child Care. It would have multiple interventions, health education, home delivery where most common, so attend home delivery, care of the baby at birth, home visit, breastfeeding support, as well as identification and management of various sicknesses, diseases of children and newborn in the community. Breastfeeding problem, hypothermia, child falling cold, preterm, low birth weight, neonatal sepsis, diffuse infection, as well as childhood pneumonia and birth asphyxia, inability to breathe at the time of birth. The second question was, it is all good to have this package of interventions, but who would deliver it? Doctors are not willing to go, nurses are not willing to go. So we decided that we will seek the help of these two women from the villages. The traditional birth attendant for thousands of years providing services to mankind, and also a new cadre of worker called community health worker. Asha is based on similar. This is Kajubai. Kajubai was 4th standard pass, scheduled caste. As is the case, husband was an alcoholic addict and had left her, and she was alone managing her family and home. So such women and traditional birth attendants, we decided to work with them, started training them very systematically using the principles of adult learning. How to treat a child who is unable to breathe at the time of birth, how to clean the entire mouth and throat. If the child is still unable to breathe, how to use ambu bag to resuscitate the baby and ensure breathing starts. In the case of infection, how to give antibiotic using simple gentamicin medicine as well as needle and syringe. Training went on for 1 year. At the end of the training, we invited a team of top 10 pediatricians and neonatologists of India to evaluate these women. See, the question was, for the first time in the world, newborn care was to be provided in the villages. Till then, the standard global recommendation was, if you find a sick newborn, send to hospitals. But where were the hospitals? So we decided, if you are doing something radical, the quality must be assessed. Dr. Meherban Singh, the man in turban, the father of neonatology in India, at that time director of neonatology in AIIMS, Delhi. Dr. Ramesh Poddar, president of Asian Pediatric Congress, president of NNF, IP, top 10 pediatrician. The passing percentage for doctors in medical college is 50%. It is literally tossing the coin. The passing percentage was 75%. Medical doctors, when they are assessed in examination, there are 2 internals and 2 externals. So we are pretty assured of passing the exam. Here all were 10 externals. And over 3 days the examination went on. They passed with flying colors, every single of this community health worker. And Dr. Meherban Singh endorsed them with this ringing statement. These ordinary looking women, semi-literate trained community health workers of Gadchiroli, know about newborn care more than the medical graduates of AIIMS, Delhi. This was credit to these women and the training method and the system. This was the first batch of the traditional birth attendant in the world who were trained in treating childhood pneumonia. This was their convocation ceremony. And this was the first batch of the community health workers trained in providing newborn care. With this, women program started visiting babies in villages, measuring temperature, measuring their weight, monitoring their weight growth, training women how to ensure proper thermal support blankets, providing group health education in the villages towards better health practices. For example, in case of home delivery, the umbilical cord and the placenta would be cut and buried inside the delivery room. Now you can imagine the impact on the health of the mother and the baby. So changing the prevailing behavior. How to diagnose pneumonia by measuring respiratory rate of the child and accordingly providing treatment. And in case of sepsis, providing injection gentamicin, neonatal sepsis, one of the most fulminating condition, how to treat in the villages, how to monitor the women, mothers for any risk factors during pregnancy, how to methodically assess their weight gain so that they ensure, also assess after delivery, postpartum sepsis, secondary postpartum hemorrhage, health of the mother. If mother is sick, she has infection will be passed on to the child. So her status, and as we progress providing mobile to this community health workers so that we constantly ensure supervision. And these were the results. When we started the work, as I said, the infant mortality was 121, came down to 20, 100-point reduction, child mortality from 153 to 23, and neonatal mortality from 100 to 17. We have achieved the Sustainable Development Goals of India. Mind you, Gadchiroli still remains poor, affected by other challenges, infrastructure not great. But when these women were empowered and knowledge was transferred, Gadchiroli achieved the SDG far before the rest of the India. Scientifically published, Journal of Perinatology, and then Lancet brought out a volume in 2006. It has some of the best papers in the history of medical science. Papers by Louis Pasteur, Florence Nightingale, Robert Koch, Alexander Fleming. Over 180 years of history of medical science, the only paper from India is the home-based neonatal care, making one of the most significant impact in the history of medical science. And then it became India's national policy program. 800,000 ASHA were being trained in providing home-based newborn care, and last year 2 crore children and newborn across India were provided home-based newborn care, and now it has become a global program impacting 80 countries. When we question ourselves as to what really happened, Time magazine declared Search as one of the 18 global heroes of health. This was the message we learned from this entire journey, is that when you bring together a local community, a local place, local action that spark locally, and the power of science, the impact is global. Archimedes, more than 2000 years back, said that give me a place to stand outside earth and a lever long enough, I will move the earth. People laughed at him at that time, but today we know by the principle of lever, Archimedes was absolutely correct. Research and science is that power of lever. So find a place, use the power of research, one can shape policies in Bombay, Delhi, Geneva and DC. I began with Gandhiji, let me end with Gandhiji. Year was 1947, August, India was partitioned, violence everywhere. Gandhiji was sitting in Calcutta. Lord Mountbatten said that my 50,000 army is unable to bring peace on the western frontier. One-man army of Mahatma Gandhi is bringing peace in Calcutta. A young man went to meet Mahatma Gandhi. Very sad, violence, bloodshed everywhere. He asked Gandhiji, what should I do? How should I find my path? Gandhiji said, young man, the solution is simple. I shall give you a talisman, Jadoo ka Taweez. When faced with a dilemma as to what your next step should be, remember the most wretched and vulnerable human being you ever saw. the steps you contemplate should help that human being. This mother and child is our talisman, and I wish you all the best on finding your talisman. Thank you, and thank you for the opportunity.